Hello and welcome all. This is FMS podcast. Our topic today is Telehealth in Primary Care. I'm your host today, Dr. Sing Yee, FMS from KK Jenjarum. First of all, I would like to thank Academy of Family Physicians of Malaysia for allowing us to use the premises for recording today. Today, our guest is Dr. Irfan, FMS from KK Puchong, with area of special interest in health informatics.
Yeah.
Welcome, Dr. Irfan.
Thank you.
Dr. Irfan will be the perfect person to talk to us about telehealth in primary care. But before first we jump into this topic, Dr. Irfan, can you tell us why you choose health informatics as your area of special interest?
Yeah, it's good to start with the why. Because also during my experience, I think why I choose area of interest health informatics. I was working in the FMS for 10 years. I think there's new things that happened during the COVID-19 because of the visual consultation and everything about digitalization. So I've tried to fine-tune what can I actually update my knowledge and also to do something new. Because if you're working for 10 years doing the same thing, I think you have to find new pathway to motivate yourself. So it's tell you with my experience during the TPC, primary care, for the past, I think, 10 years. So I know a bit about telehealth and everything. So that's the time that I think better I do something that improve our quality of service, knowledge that I would like to share to our FMS, Family Medicine Specialist, and also to our population.
True.
I start with the opportunity to learn. I think I'm the first one in the family medicine specialist to do that. Because suddenly, just because of the COVID, because of that situation, they start to offer health informatics for 1 year. So 1 year, no problem.
Alright. So can you tell us more about what is this health informatics? What will be the topic that will be covered during your training?
So overall, health informatics is obviously they call it digital health. I think it's just about the same. When we learn during the digital health, we learn about the application, understanding of the framework of the ecosystem in digital health. Definitely, we learn a bit coding using Python, artificial intelligence. Bear in mind, we also need to know about the security, legality of the health info. And all the apps for us, our family medicine specialist, we're not really the person that need to know how to do coding because at this kind of things, you know that's ChatGPT, everything cannot do coding, but we need to aware if they want to implement any system in Malaysia, we have to be the advisor whether this kind of thing is good or not. So a lot of things actually in digital, it's not really in the health service, it's everywhere. Everywhere. Everything bank sector. Everything.
Alright, okay. So I fully agree with you. So as another FMS trained in this area, health informatics too, my reasons I take up this one actually is because I'm thinking that this is like a new area that is developing very fast in our fraternity. Right, so I want to be the person who is able to understand and also contributes and also, like you said, to maybe share my opinions when the policy is being made or how we're going to improve our healthcare service to the patients. Right, okay. So again, one of the things that I have in my mind is instead of patients coming to us, right, that is what that we should brought the patients, give the convenience to the patients for them to easily access to the healthcare system. So telehealth will be, or virtual consultations will be one of the way forward.
I totally agree with you. And also very good that I have you as part of our team for digital health. I think we need to get more people to do this kind of things. It's not really usually telehealth. You really talk about the one with any technical advisor, such as from the IT person. But I think for us as family medicine, I think we need to be the pillar of the things that they want to implement mainly in healthcare.
Yeah, correct.
I think you are in the same part with me. I think it's very good.
Yeah, so for those who are interested in health informatics, so like Dr. Irfan has mentioned, it is not only about the virtual consultations or this. There are many pillars of it. They have a data collections on it. Okay, so the electronic medical record system. So do join us into this area of special interest. That will be very interesting areas for you to explore.
All right.
Yeah. So first of all, Dr. Irfan, can you tell us more about your journey in telehealth in primary care?
Yeah, thank you, Dr. Thung, for inviting me to this Saturday day to give some sort like sharing actually. I'm not really give a talk, but actually sharing what is my experience in telehealth. At the moment, I'm working at Klinik Kesihatan Puchong, Batu 14. But previously, mainly I'm working in Sarawak, Sabah, Negeri Sembilan, and Selangor. Yeah, I remember that during last time when I was in Sarawak, I think at the year of 2003. That time, we as a new MO, this is a district hospital. Mainly at Hospital Muka. If you know, Muka actually is central area of Sarawak.
Yeah, true.
It's coastal area. So this is district hospital without specialists. But when we are working there, we need to refer case to Hospital Cebu.
Which is quite a distance away.
Yeah, at that time I think roughly around 3 to 4 hours. And then we have to go by ambulance, and ambulance have to go by ferry. And again, you have to go by coastal road, going to palm area, forest station, and I have to go to sea.
I can't imagine if we have an emergency.
I remember that time when we have to contact our specialist, we are only using the telephone. So difficult. Although during that time, we don't have some sort like this handphone now, like smartphone. We only have, I remember,
just calling in and out, all kinds of phones.
We have a Nokia. I think the old Nokia one. That's the only thing.
Means that.
And then in that situation, I was working with the 3 doctors, busy hospital. And luckily during that time, our Ministry of Health actually implement one of the, I think it's good system during that time, is tele primary care, TPC. So my hospital during time is one of the pilot for this program.
It's one of the pioneer then.
Yes. But usually as a normal medical officer, we use the, very surprised we get computer and we are surfing the internet during that time. But it helped me to record patient, data, everything. And the most important things about primary care during that time is the system that we can converse and communicate with the main hospital by using, whether during that time the video consultation is not very familiar, but we are sending the information like X-ray then to the hospital. So that's the initial part of the involved in the telehealth in my working place.
But it will be more of the MO with the specialist communications rather with the patients, right? So at that level, it is more for the between the inter-hospital facilities or inter-health facilities, right? Oh, okay.
That's it.
All right. Okay. So can you tell us more about your involvement after that? Since that,
being Jenny as hospital doctor during that time, I was been transferred to also hospital actually, Hospital Sarato. That also in the rural area. And then after that, I was not really get into it primary care, but when I'm working there, I know there's always a problem to communicate with the specialist.
True.
So we have to find idea, how to communicate, how to consult. I remember one of the incident. This is my friends actually working in Hospital Kapit. Kapit is more to rural sea area. That
take a few hours to go in, right?
During that time, there's only using boat to the Hospital Cebu because that's central area. I remember that during that time, he explained to me that he doing Caesar. The MO there, medical officer, they have to do Caesar for emergency case. So then they have a problem how to do operation because they are not very so-called experience. Sometimes we learn from the nurse to teach us procedure, and then they have a problem like placenta previa bleeding quite a lot. So during that in surgical operation, they have to contact the specialist. The problem about during that time, I think it's already 20 years back, they have to communicate. There's no other way that you want to explain what does it have. Maybe you just take picture and then send to the specialist in the hospital Cebu to how to consult that emergency case. Yeah. So it's quite important for us actually to know how to deal with the telehealth, how to implement in our current setting. But I know now it's much more better.
Yes.
Yeah,
true,
you
correct.
can see that many things happen for the past 20 years, especially during pandemic.
Yeah.
Yeah,
Yes.
you know what happened during pandemic?
Yeah, I think this telehealth, but Dr. Irfan certainly has a vast experience, right, in working in various parts of the Malaysia, in Sarawak, in rural area, in the suburban and also urban area. So Dr. Irfan certainly has a lot of experience in the different setting of the healthcare facilities here. So what Dr. Irfan has described to us is about the initial of this digital healthcare or telehealth, mostly used in the inter-hospitals or inter-health facilities between the healthcare professionals. But we know, since you mentioned that during the pandemic time, this telehealth program has been brought through to Klinik Kesihatan for us to communicate with our patients. Right? Can you tell us your experience about this telehealth for us with the patients?
We know about telehealth video consultant mainly during the COVID pandemic.
Yeah, true.
During that time, I'm already become a specialist, family medicine specialist. I remember during that time I was working in Klinik Kesihatan Tanah Putih, Kuching area, because I've been moving all around. So by the end, after I become a specialist, I was working in Sempurna, Sabah, and I go back again to Sarawak, mainly Kuching area. So Kuching actually mainly that urban Kuching area. We worry about COVID-19. You know about that situation.
We are trying to reduce all the contact at that time.
We reduce the contact, and patient want to go to clinic or the hospital.
Yes, patient reluctant to come into, correct.
Yeah, I remember during that time, it's easy to go to clinic from my house. It's just around 20 minutes.
No traffic.
But at the moment we can't do that now. No more pandemic.
Okay.
But the idea during the visual consultation during that time actually how to prevent to reduce the risk of transmission.
Correct.
So we have no choice. So everyone have to use some sort different methods. Not allowed to come patient to the clinic, but you still have to manage it.
Correct.
So then we know about book talk.
Yes.
Yeah, I think one of the earliest telehealth is using book talk.
So the very initial kind of the
very initial, but we are not mainly we are not internet savvy. We are just during that time. Although I'm specialist, we need to learn few things, few steps how to handle book talk, and from that actually they have to fine tune how to connect with the people, how to give treatment, how to give medication. That's the things that we started know about visual consultation mainly. So then we start role as a part of to reduce risk of transmission. We allow patient to stay home. We allow to communicate patient through video consultation and also face to face using that any other platform. But it's difficult actually. We also know Sarawak maybe there's a little bit more motivation for them to teach how to use it actually.
Before we want to zoom in and talk more about about telehealth, I think some of our audience here are public. They might not be very familiar about this telehealth program in our Klinik Kesihatan. So Dr. Irfan, can you tell the public how they're going to engage to all the Klinik Kesihatan through this telehealth? How are they going to register, or how they're going to get access to this telehealth?
I remember during last time when I need to give a talk how to implement the telehealth. But in the broad term, telehealth is not really visual consultation only. It has a different part whether we are using the mobile health, also part of the visual consultation. Although remote monitoring also part of the telehealth.
Yes.
And also the main focus here is visual consultation.
Virtual consultations that we've been using in the clinical sector right now. Yeah.
But for us, how do we engage them? That's important thing. Definitely, we have to find right person and the right time, when to use and how to engage. Ministry of Health actually do a lot of things to promote this kind of thing. We do some sort like we are focused on the main clinic that was involved to be training to them, mainly to the medical staff how to use it and to promote in any social media.
Correct.
To give how to do it. Sometimes we can see it quite difficult actually for the first timer. Although me also in the digital health also find quite troublesome how to click this one. But I think in the area of using the My Sejahtera during COVID, they are more focused and they're more easily friendly to use it because everything the Ministry of Health how to use is let them put as we would say that it's compulsory first. Remember during the My Sejahtera time, you have to go shopping mall, you have to use the My Sejahtera. Then they can track where are we. You can know whether there's a COVID case there. Then we don't go there. So we, as a Ministry of Health, they want to make it easy for us using these apps. Alright, and also many kind of things using Skype. Previously, I'm using Skype to connect to talk with my friend using Google Meet.
Just for the knowledge of our public audience here, so if you wish to engage with a clinical assistant about this telehealth or virtual consultations per se, that what you need to do is when you go to the clinical assistant, you can ask the medical officer that for your follow-up, are you suitable or are you eligible for these virtual consultations? Then if they think that you are suitable, that for the next consultations, they will sign you up. Okay, of course you need to give your consent and they will sign you up. And of course you will engage with the medical officers through the email they have provided you at the time and also the appointment that has been given to you. So just now I mentioned something about eligible, right? So who do you think the group of the patients that will be eligible for these virtual consultations?
That's an important question actually, because we don't want to make the things and it's want to make it happen.
Yeah.
So that definitely the client, I will say the client also, or the patient itself need to have a better phone connectivity.
Of course.
That's always the issue everywhere in Sarawak.
Yes,
really.
true.
But now it's getting much more better. And then the person actually have to know a bit sometimes they need to have a email, know how to use phone. But in this area of situation, most of them can use WhatsApp and they also can use TikTok, everything. So easy for them to learn. And also during that time, you have to find the suitable patient for using this visual consultation. Not all patients that can use the visual consultation. Mainly at the moment, we are focused more to chronic care disease.
Chronic care diseases, like what kind of cases that you'll be using this?
Mainly we are focused for the diabetes patient. And also at the moment, I just recently, Minister of Health actually tried to introduce the Mama Maya. This is, have you heard Mama Maya?
Can you tell us more about this?
Yeah, this is the things that we implement, I think, started this year, using the visual consultation, mainly using the person who is diabetic, but diabetic in pregnancy.
I see.
So the person that will give consultation, advice through Mama Maya is dietitian. So we not really focus for doctor per se. We also extend our service to the any allied service such as dietitian can give briefing, talk about how to manage diabetic by consultation, dietitian using the group consultation from first point of, like say from the clinic A and then they will connect to other rural clinic. Then it's okay for them to start
that
with.
is a very good program, as like say that they wouldn't have to make their own way or take one day off just to come here for the dietitians or the diabetic educator these consultations, which they can just do at the comfort of their workplace or at their home through the phone that is through the link that is provided, and they will be very much confident that the message they given that will be the proper message rather than just scrolling their TikToks for some message on this diabetes, right? Yes. So besides this diabetic group, is there any cases that you encounter in your clinic that the patients is suitable to be in the virtual consultations?
We talk about diabetic, we talk about gestational diabetic. We also use for visual consultation for patient TB case. That we usually in TB case, we must make sure that they are taking the medication properly at a certain time.
Yes.
Compliance is always an issue. So what we implement during in the TB program, actually they call it VDocs. So patient will take video of himself taking medication properly, and then after that they send to doctor.
So it will be a video.
It's video.
Video
type.
A video type.
So the telehealth not really you need to talk to the patient directly. You also can use it as some sort of video recording and as a proof that you are taking the medication, and you send to the doctor.
Yeah, I would think that is a very smart move. As some of you might not understand, DOTS, DOTS is one of the initiatives that we use for the TB patients to ensure that they are compliant or eating their medications. So the patients have to travel to clinic setting every day and taking the medicines in front of the healthcare professions. But as you know, it will be a hassle to the patient. So using this video, patients will be recording them taking medications daily and as a proof that they are compliant to medications.
I think it's easy for patients. Yes. They don't need to come to the hospital or clinic.
Correct.
They also can work during that time. Like let's say they have a work, they don't need to take annual leave just to go. Troublesome to find a parking place, find the time. It's always trouble. But definitely we have to find proper patient for these kind of things. That's the issue. We just cannot simply just pick up any patient to train them.
I see.
At least we assess first. Then it's better.
So is there any other cases that you think would be suitable for virtual consultations?
I know that in the private sector, it's only not only Ministry of Health, but the program outside is, we call it Doctor on Call. This is maybe you can Google it, Doctor on Call. They are quite pioneer doing the virtual consultation. I think started 2016. So they start during that time before pandemic also. They already start how to find the case that's suitable for that telehealth consultation. They can focus for dermatology case. They also can cause the patient have a complaint. Any complaint they can book through the application to get any case basically. But dermatology I think is quite good actually.
Okay, so instead of just what we call chronic cases or the TB cases, so there are some that is using it as like outpatient cases, like I said, especially in the skin conditions. In my clinic too, we are using this one for for health screening patients. You see, we use it like when patients after they're taking their bloods or their blood screening. So instead of them need to come back and review their blood test, we will go through the virtual consultations and telling them that actually, you see your maybe your sugar is a little bit high, that you might need to lose weight or these things through the consultations too. So I think that will be one of the parts too.
The one with the diabetics, sometimes we review the blood sugar profile. I think because the main concern for us, how well actually is patient being controlled diabetic at home. Although it's diabetic,
for blood glucose monitoring.
We can ask them to check the glucometer or dextrose and then plot on the paper itself. And then at the same time, actually, the doctor maybe can consult them to see what's the value. But in the term of digital health initiative, we can say that much more easier for us at the moment. But some of the, let's say the glucometer is been connected to the Bluetooth to the phone.
Yes.
And then sometimes it's just directly connected to you by using web application. So easy, not need to mainly because it's not really sometimes we need to have to do proper visual consultation.
Right.
But me as a doctor, sometimes we want to know whether is the patient actually taking the medication properly, control the diet properly. So we need, let's say, data to confirm that is he good or not. So in this, let's say it's problem during that time to review all the results, we can contact them, adjust accordingly.
Yeah.
So in this kind of thing, I think it's
So it means the instructions or the discussions can be discussed through online only. The patients don't need to come all the way just to review their blood sugar control, right? Yeah, so that will be a very good initiative. So we have talked about so many cases, and so as we can see that maybe the audiences already can see that there are a lot of benefits, right, through the virtual consultations or telehealth. That is not only save the time, save the hassle of coming all the way. So it's also provide like some sort of like another way to get access to the healthcare services. So now rather than patients come to us, so now we bring the healthcare to their home, right? Yeah. Okay. All right. So thank you very much for Dr. Irfan. But we can see that, right, there will be some challenges or limitations in these virtual consultations of telehealth. So what will be the challenges or limitations that you have encountered through your practice?
It's always a challenge to do something new, something, let's say for us as a doctor, we need to embrace our digital technology. As years goes by, we can see that other side of the country, I was doing the attachment in the Scotland last 2 years for 3 months, and then it's always when we talk about Scotland, they have many island remote monitoring. So they're based on, let's say, the city of Glasgow. There's many island that they are unable to come to the clinic because of the distance, because of the climate, and because of the transportation. So in that situation, if I apply to in Malaysia, the challenge is always how to get the quality over there. Whether let's say the Sarawak, many problem of the connectivity, because people will say that how can we do the visual consultation if the connectivity is always an issue. But I think from the area digitalization, especially in the Malaysian situation, we are really work hard to improve our service internet in the rural. So surprisingly, in KL, I also find it difficult to get an internet compared to Sarawak. I don't know why, because maybe too many people. So I think Sarawak is much more better. Definitely Sarawak much more better because they are very support from their state country.
Okay, so attention to all this Wi-Fi company, Alright, some comments here.
That's always there lah. But I know there's always challenge to the people itself, the person itself, to learn, to engage to the kind of system. I remember last month, there's one lady, only 80 years old, almost there. I said, what are they doing actually at home? Because there's no one there. The daughter, son, always working. The husband passed away already. So she said that she go through TikTok and learn about how to manage the things from TikTok. So 80 years old can use TikTok. So what about us?
So it's not only us need to continuous learning, even the 80 years old auntie is still continuously learning.
So for us, as ministry, we can provide this kind of thing to learn, to teach them using the TikTok.
So we promote through this social media.
Facebook is not so popular at the moment. So I think TikTok is much more easier. Maybe another challenge is always there for us to be more confident to use. Some of the things where you talk about few of my colleagues, why don't you do visual consultation? Definitely they say that there's a lack of empathy because the patient just at the mirror there.
Yeah,
You
it's just a
can say,
screen.
then we say, maybe this is scammer. Oh, don't know. The scammer doing that kind of thing because it can be everyone can do it.
Yep.
Yeah, it's always that issue problem. So they're afraid. Someone call you to get appointment for consultation. So no, there's a link there. Okay, is it scam or not? Okay. So we need to engage the person much more earlier.
Yes.
Let's say we make appointment, we set. Important is consent.
Yeah.
Explain about the nature of visual consultation.
Yeah.
Sometimes they don't understand.
Yes, maybe some of the public, some of the patients, they are not familiar yet with this.
Yeah, you need to explain it at the base because in Ministry of Health at the moment, when you are doing the visual consultation, you must get consent earlier.
Yep.
To make appointment and also to arrange, to explain and to teach them how to use.
Okay, true.
Yeah,
true.
Yes.
Alright, okay. So just now Dr. Irfan is telling us about some of his challenges that he faced. Mainly sometimes I think there will be two parts. First part is from the healthcare professional. Maybe they are not very tech savvy but continuous learning can overcome this, right? Okay, so we just have to be familiarize ourselves with the platform that we are using. And I think actually one of the big hindrance is actually from patients. Like you say just now, patients need to have proper emails before we can engage them, right? Okay, so to get a proper emails, and some patients too might not be very tech savvy too, that they will be able to use this platform. But again, this is a way to learn, a way to learn. And of course, connectivity, the internet functions, Wi-Fi functions would be one of the challenge things that we need to overcome it. All right, okay. Do you have any other challenges that you faced during this time?
Let me think first. For us,
how about that? Some patients might be worried about that. If you go through a screen, right, you might not be able to do physical examinations, right? Will it be one of the limitations that you see?
You have to accept that there's always a limitation when we are to embrace the technology.
Yeah, true.
That's why the first important thing, the eligibility of patient to be enrolled in the visual consultation is important.
And where to choose the patient.
Yeah, but in the term of the physical examination, we can use any support modality to get more info from patients, such as using the self-monitoring blood pressure.
True.
So then we can know how's the blood pressure. Also the glucose meter also can.
Alright.
I remember during the COVID time that we are using the SpO2 monitoring. So we can know whether this is urgent or non-urgent. Let's say this is urgent, patient come to see you with 90%. Definitely it's not the way to do the visual consultation.
Correct.
So then we have directly asked the patient to go to see a doctor.
Yeah.
Directly. But another thing about visual, you can see your image. So because I'm doing the digital health technology, artificial intelligence. So from the image that we can see from the screen, you can take picture of that, and definitely most of it we can know what kind of the skin lesion that we are concentrating on.
Yes.
But we have to accept that sometimes we cannot just listen to the heart, listen to the cardiac. But one new things that I was been experienced is one of the product from India. They are using the cough recognition.
Oh yeah, I heard about
you heard about
yes.
They ask patient to cough using the phone, and then they can detect, oh, this is asthma. How is that COPD? What kind of type of disease per se by using the sound? I think this quite nice.
I think with this AI coming to us, right nowadays, even without the true physical examinations, there are a lot of modalities like you mentioned that it can help us. It's not only the simple, just the blood pressure, SpO2 or glucose monitoring. Nowadays, smartphone actually can be used like to, or watch or any wearable devices actually can be used for the heart rate to detect arrhythmia or like you say the cough things that will add on to the virtual consultations for the accuracy of our diagnosis. Right. Okay. So there's actually a lot of things that we can explore through the virtual consultations.
But it just take time to our population to be aware to accept this kind of thing. A lot of things. If you can see that China, you can see, you can just take picture and you know, oh, this one patient got maybe possible diabetic complication. Just using face, but that's another topic to say.
Yes, true.
For today,
using the model AI models for this one, right? Okay, too. But again, like you mentioned, right? Then the patients have to make sure they on the camera because through my experience, there are a lot of patients malu that they don't want to on the cameras when during the virtual consultations. So we'll want to advise the patients if you want to fully utilize the virtual consultations, yes, please on the cameras too. Right, okay. Alright, so how about some patients, right, they might be concerned about, like you just now mentioned, like, they might be concerned, whether this will be the scammer or they will be concerned about whether the confidentiality of the consultations will be maintained through the virtual consultations. What's your view on this?
Ideally, in the real world situation, for our government do is the apps, the software, the application that we use is being recognized by Ministry of Health.
Yeah, true.
So it must be confidential that we explain to the patient earlier, to the patient to be known about this risk. But for us, at the moment we are using the mainly MyVast. MyVast actually is just a website application that will connect to the MySejahtera. It just complement each other. I know we are as a person we are using MySejahtera, but as a primary healthcare provider in the Ministry of Health, we are using MyVast. The MyVast actually a platform that been we know about the data security. It's based on the monitor by Ministry of Health. It's a local there's local data where when they are open this kind of things, they make sure they comply when we call about digital, the proper encryption, the data security,
the
password, all the password. If not, anyone can go through this platform.
Yeah, true. So don't worry, the MyVast is a secure platform. Only healthcare professional that with the access that they can access to this, right? Okay. Okay. I hope that this will send a message to the people who are trying to use virtual consultation that this will be a secure platform to be used, right?
It's the way to go.
Yes, correct. Okay. Alright, so for just some thoughts about this, what do you think will be the future of this telehealth or virtual consultations?
I imagine during next 5 to 10 years, our clinic, mainly in the rural area, will have good connectivity with using the visual consultation to ease of the patient accessibility to us. Then I also imagine that we all as primary healthcare provider, also in the hospital base, accept this kind of thing to be the way to go, the way forward. You know that our ministry also, our government also implement many things in area of digitalization. We have to bring forward. We have to focus. We have to be tally with the other counterparts, such as Singapore. They are very good also, and also the side. So we have to be more positive. Although we know there's always barriers that we need to overcome. We need to promote it to the maximum level, and then explain a bit more to our population that this is the important things that we are going to embrace. Because when you are doing the digitalization in the visual consultation, it helps reduce a lot of the cost we talk about the cost, mainly the cost of the patient itself.
Yeah.
In terms of public transportation,
To come to clinic.
car,
Yes.
parking,
Yeah, true.
time.
True. The time and the money wasted
Money
just to
saved.
make the trip.
Because one of my patient, when they doing visual consultation,
Mm-hmm.
they are doing while they are at work. So they just take about maybe half an hour off from their working
Yes.
environment,
Mm-hmm.
and then connect to us.
Mm.
Then after that, they can come back to
continue to do
work
work.
everything.
Yeah, yes.
Because most of the patient previously they have to take one day off
Yeah.
to go,
True.
and then it's troublesome.
Good. Yeah, so well, the time that they get a consultation, they can still maintain their work and productivity. Yeah, excellent.
I think that's a good
Excellent.
thing.
Yes.
That we need to do.
Alright, okay, so virtual consultations will be the way forwards. And then
agree.
on top of that, I'm sure that with a lot of these AI big models and all things, it will complement more. Okay, it will make our teleconsultations or telehealth be more efficient, right? And more accessible to all our patients in clinic.